We're joined now by Gabby Salinas. Gabby, good evening and welcome.
Thank you. Thank you for having me.
So just a couple quick housekeeping notes from me, and then we will jump into your questions. Those of you just joining us, you can type your questions into the Q&A feature of Zoom, and we will try to ask those if there's time at the end. Otherwise, we've got 3 questions to ask Gabby, and then Gabby, if there's time, we'll allow you some time at the end to talk about any other topics you want to touch on before we end the interview. So with that, we're going to go ahead and get started, okay? So Gabby, first question, Governor Lee recently issued Executive Order number 15. Among its provisions includes the ability for nurse practitioners to practice with autonomy. What's your position on the expansion of scope of practice from non-physician providers such as nurse practitioners and physician assistants?
Yeah, I don't support that portion of the executive order. And I've been reading, and last time I ran, I talked to TNA and TMA as well. And I know that there was a compromise of adding more training to nurse practitioners. And if you hold on, I don't know what happened to my screen.
I stopped sharing the screen. That was my fault. I'm sorry.
Okay. So I remember that compromise, and from what I have been reading, that compromise is no longer there. So therefore, I do not support the executive order.
Okay. Thank you.
Or that portion of the executive order, at least.
Right. All right. So we'll keep going, jumping into the second question. So there's a lot of difficult decisions being made nowadays that force business owners, parents, policymakers, everybody really, to balance their personal physical health and even the health of a community with economic health, and that, kind of overarching desire to get back to business. We hear that phrase quite often. Can you describe your thought process when you're faced with these challenges, assuming you're elected? How are you going to balance those health versus economy decisions?
Yeah, I think, as a candidate myself, having campaigned in a time before COVID and a time after COVID, I've had to make these adjustments, right? In the way of fundraising, what we're doing, we're no longer canvassing. Everything has been moved virtually, where we have been able to, because for me, the priority is the health and well-being of people in my district. However, I also understand that, this is not going to go away anytime soon. So we have to have the ability to regulate depending on how our cases are going, making sure that people are wearing masks, making sure that masks are available. And if we can do contact tracing and keep our numbers low, our options for opening restaurants, for opening things, obviously it's going to look a little different, but we're going to have more options if we have our mitigation strategy really strong. And I think that's where Tennessee's failing, is not having a strong mitigation strategy and feeling the pressure of wanting to open without that strategy in place is why we're seeing the results that we're seeing. I come from science. I work in infectious diseases. I work in malaria. It's a little bit different. But I think I'm uniquely qualified, and I'm more qualified than a lot of the people that are in government right now, because I look at the evidence. I know that safety matters, and that protection equipment works, right? I work in a BSL-2 level lab, and I have been in BSL-3 levels, and I know that PPE, the importance of PPE. So it was so hard to witness and see the lack of PPE with our medical professionals, especially because they're our frontline workers when it comes to treating people with COVID. So it's a complicated thing. We need to have room for adjusting and going back and forth, right? Right now, our cases are high, and we don't have the infrastructure to do contact tracing right now at the rate that we're at right now, right? So we need to kind of dial back, wait, and then make sure that we can still move forward. That gets under control, because realistically it's going to be a year or more before we can get a vaccine available, and even then, there's a lot of limitations on what we're learning from immunity COVID right now. And then there's the production side of it, right? I work in drug discovery and we produce drugs, which are much more simpler to produce than a vaccine. So we need to have that flexibility there that I think is lacking.
Okay. So kind of staying on the economic front a little bit, our state is going to have a lot of economic challenges due to revenue shortfalls, mostly associated with the pandemic. Can you talk about your thought process on how you would prioritize those inevitable cuts? And if so, would you cut healthcare spending?
So I wouldn't cut healthcare spending. I would expand Medicaid. That would bring $1.4 billion to our Tennessee economy. And we are the biggest in all of this here in Shelby. We are the largest county and the most medical county in our entire state, right? Healthcare is such a big part of our budget. So I would expand Medicaid expand Medicaid so that we can bring those federal dollars, and the majority of that money is going to come to Shelby County, right? And right now, with everything that's happening in our hospital closures that are happening in counties that are surrounding Shelby County, put pressure on Shelby County because people are coming to our hospitals and we're going to have to take care of those people, right? And that puts a stress on our medical system, right? But going along those lines, the governor just put a little over $300 million into our rainy day fund. We're literally drowning. We shouldn't be putting those funds into the rainy day fund. So there isn't a lack of money because we put that money there. So I would use that money for unemployment. Right now, they're losing their health care coverage right now, right? And we're gonna have to absorb that cost if they don't have access to health insurance, right? Today I saw a new figure that it released was 5.4 million people have lost their health care. So I would shift those funds so that people have the money to be able to purchase insurance either through the marketplace or through getting covered through Medicaid dollars. That's very important right now, especially when we talk about medical coverage and medical expenses in the middle of a pandemic in a city that is such a medical city, right? Methodist, St. Jude, Le Bonheur, those are here, right? And when we look at our state, this disproportionately affects Shelby County.
All right, thank you. So we wanted to leave some time here at the end. If you have, healthcare issues you want to expand upon, or if you want to talk about some other issues, we've got a little bit of time here, so feel free to take it.
Yeah, so I think I fill a very unique role in all of this. I have not only dealt in healthcare as a patient, but as a scientist. There's very little people that have that experience. I've been in healthcare since I was 7. That's when my experience started. And I understand both sides of it. And there's very few people that have that experience. I understand the scientific side of it and what we need to provide for patients and what the limitations are within the healthcare system we have. But I also understand the side of being a patient and not being able to access health insurance and having to pick between, oh my gosh, what am I going to do? I can't pay for that medicine. I'm a graduate student, graduate student coverage is very minimal because we're not really considered employees and we're not really considered students. We kind of fall in this in-between phase of making too little to qualify for benefits through the state, but making too much to get healthcare through our employers. So I have a unique perspective when it comes to understanding this issue, and I think I could be a great advocate for people in healthcare because I have worked in healthcare. I've been this is the issue that got me interested in politics. I've never thought that I would be running for office, but I just got so frustrated being a cancer survivor in a time before the Affordable Care Act passed, having a pre-existing conditions, childhood cancer survivors grow up to be adults with pre-existing conditions, and being frustrated on that side of, meeting with my doctors and then saying, this is what we recommend, but your insurance doesn't cover it. Or I mean, when I got started, we had lifetime caps. I did not know what I was going to do, because I had gone way over that cap when I was a teenager, before I was a teenager. So we're getting better. I would love to be the person that drives a lot of these changes forwards. And I think I can be an advocate unlike any other that we've had at the state level.
All right, great. Gabby, thanks for the time tonight. Good luck to you on the campaign trail. I know it's challenging out there with the roadblocks that the pandemic may put in front of you, but good luck to you either way. And,
yeah. Well, I mean, with each challenge, there's opportunity for creativity, and so I'm open to the challenge.
All right. Well, thanks again for joining us. Have a good evening.
Thank you.
Take care. All right. Up next, in about 4 minutes, we're going to be joined by Alan Creasy. I see Alan's already set up and ready to go. Thanks for joining us, Alan. We're going to start your interview promptly at 7 p.m. So we're going to take a short break, and we'll be back in about 4 minutes.